pass it over to you.
Thank you. So just checking to see if Letty is on. Can
We do not see her in our participant list.
Okay.
But I will let you know when she joins.
Great, thank you. So, welcome everyone. This is the last meeting we have for this fiscal year. So we'll send it off with a bang. So I will turn it over to, let me introduce myself for those who don't know me. I am Cindy Kaufman. I am from the ADRC in San Francisco, and I welcome everyone. So now I will turn it over to Wilson for roll call.
Yep, and housekeeping. Hi, everyone. Wilson Tam from the California Department of Aging. I have the privilege of leading our person-centered navigation branch, which includes our ADRC, health insurance counseling and advocacy program, and also our Office of Long-Term Care Patient Representative. General housekeeping, the meeting is being recorded, and the recording will be posted onto the CDA ADRC website, knowing that's like the #1 question that people have when it comes to like webinars and meetings. And those for those attending in person, please do mute your laptop to avoid any audio feedback. Accessibility, we have closed captioning that is available and can be accessed by clicking the closed captioning or the CC button on the Zoom toolbar. We also have 2 ASL interpreters in the meeting today. If you need the interpretation, click the interpretation button at the bottom of your Zoom screen. If you need any general assistance at any time, please email us at adrc@aging.ca.gov. This mailbox is being monitored. We ask that all attendees remain muted unless presenting or called upon by the chairs to speak. To enable us to know who is speaking, please say your full name before talking. For those attending by Zoom, use the raise hand function and unmute to speak when called upon. For those dialing in by phone, press *9 to raise your hand, and when called upon, press *6 to be unmuted. There is a public comment period at the end of our meeting for non-committee members to speak. And lastly, the chat and Q&A function can be used to communicate any questions to the host, in addition to the email. With that, we'll go ahead and jump into roll call, in which I'll call out the names of each committee member. And then if each member could just say, introduce yourself and include your title and affiliation, that would be great. Starting with our Independent Living Center representatives, starting with Armin Damani.
Good morning, everyone. This is Armin Damani, ADRC Manager for Marin Center for Independent Living.
Thank you, Armin. Next, we have Larry Grable.
Executive Director, Service Center.
Okay, I see Larry's here. I think he's joining by phone. We'll go ahead and have Larry. Larry, you want to try one more time?
Yeah, excuse me, Larry Grable, Executive Director, Service Center.
Got it. Thank you, Larry Grable, Executive Director for Service Center for Independent Life. Next, we have Letty Zuno. I believe she hasn't arrived yet.
She has reached out for her link and she's having some Zoom trouble, but I'm working with her, so she'll be joining soon.
Okay, thank you. Moving on to our Area Agency on Aging representatives, Cindy Kaufman, who introduced herself already. Next, we have Joe Cobry.
Yeah, hi, good morning. Joe Cobry, Director at Passages, Area Agency on Aging for Planning and Service Area 3. That includes the communities of Butte, Colusa, Glen, Plumas, and Tehama. And we're a designated ADRC, and we are also the designated Caregiver Resource Center for our region. Thank you.
Thank you, Joe. Next, we have Liz Pastral.
My name is Liz Pastral. I'm a program manager at Agency on Aging Area 4. We serve Nevada, Placer, Sacramento, Sierra, Sutter, Yolo, and Yuba counties. Out of breath.
I know.
Thank you, Liz. Almost sounds like you were trying to compete with Joe when he was naming all the counties now.
Not a caregiver.
Lastly, for our AAA representatives, we have Pam Arnsberger.
Pam also is having a little bit of Zoom trouble, so we're.
Thank you. Moving on to our lived experience representatives, starting with Carl Sigmund. Okay. Carl, when he joined us, let me know. Next, we have Carol Leish.
Hi, good morning. Carol Leash, consumer in Ventura County.
Thank you, Carol. Next, we have Erin Crutcher.
Good morning, all. Happy Friday. Consumer representative in Orange County, California.
Thank you, Erin. Next, we have Partha Mahapatra. So, Partha, okay. And last but not least, we have William Reed. William, okay. Moving on to our ex officio representatives. I'm sorry. We actually have more representatives I haven't mentioned yet. We have our long-term services and supports representatives, starting with Abby Pascoa.
Good morning, everyone. This is Abby Pasqua from Aging Next.
Thank you, Abby. Next, we have Kelly Takasu.
Hi, good morning. I'm Kelly Takasu. I'm the Senior Public Policy Manager at Alzheimer's Los Angeles.
Thank you, Kelly. Next, we have Melissa Jacobs.
Hi, Melissa Jacobs, representing Sacramento County Department of Child, Family, and Adult Services, Senior and Adult Services.
Thank you, Melissa. Ramon Castelblanc.
Ramon Casablanc, San Francisco State Professor Emeritus Public Health.
Thank you, Ramon. Rita Science.
Rita Science, Special Advisor to AARP Executive Council, California.
Thank you, Rita. And Sherry Raisler did express that she would be absent for this meeting, but we will recognize Sherry. Next, we're moving on to our ex officio members in alphabetical order based on acronyms. C4A, California Association of Area Agencies on Aging.
Good morning, Christina Mills, Executive Director of C4A.
Thank you, Christina. Next, we have CalVet, California Department of Veterans Affairs.
David did express he was unable to join today, so I'll.
Got it. Thank you. Next, we have CCOA, California Commission on Aging.
Good morning, Dr. Ben Howdige, Commissioner with the California Commission on Aging, and also Stakeholder Advisory Committee member with the San Bernardino County ADRC.
Thank you, Ben. Next, we have CDA, California Department of Aging.
Hi, good morning, everyone. Denise Leiker, Deputy Director of the Division of Home and Community Living for the California Department of Aging. Happy Friday.
Sarah Steenhausen, Division of Policy Research and Engagement at the Department of Aging. Good to be here.
I'm Susan Rodriguez, Assistant Deputy Director for the Division of Home and Community Living with the California Department of Aging.
Great. Terrific. Thank you. Next, we have CFILC, California Foundation for Independent Living Centers. Done yet? Okay. Next, we have DDS, California Department of Developmental Services.
Good morning, Allison Giannini, Aging Services Branch Chief. Nice to see everyone.
Good morning, Allison. Next, we have California Department of Healthcare Services, DHCS.
Tom, we can't hear you, but we see you talking. Unfortunately.
Hi, Tom. If you can hear me, we see your lips moving, but no sound.
How about that? Can you hear me?
Yep.
Okay, perfect. Sorry. Hi, Tom Lee with the Department of Healthcare Services, Home and Community-Based Services Policy.
Thank you, Tom. Next, we have DOR, California Department of Rehabilitation.
All right. Hello, everybody. Happy Friday. Sarah Harris, Senior Manager in the Living and Assistive Technology section at the Department of Rehabilitation.
All right,
Thank
and
you.
good morning, Kim Rutledge, Director, Department of Rehabilitation.
Hi, Kim.
Hi, Kim. Thank you. Good morning. And last but not least, for our ex officio members, we have SILC, State Independent Living Council.
Good morning, Carrie England, Executive Director of the SILC, and I'm joined by Allison Viramontes, Non-Legislative Specialist.
Thank you, Carrie. Thank you, Allison. Are there any members that have joined us and have not been had an opportunity to introduce yourself?
Good morning. I am Carl Sigmund up at Flames.
Thank you, Carl.
I'm Rebecca Berry. I'm a Program Manager at CID San Mateo.
Thank you, Rebecca. Okay, I'll turn it back to you, Cindy.
Thank you, Wilson. I also skipped a piece that I want to go back to is just making sure everybody got their meeting materials that included the agenda, the minutes from January's meeting, the committee work plan, the ADRC mission, vision, and values presentation, although I think it was the memo that was included, the proposed memo, and the committee meeting calendar. So if not, let us know and we can send some off to you. And as always, we want to hear from everyone. And I know that a lot of times the folks in the room have a tendency to get priority, so we'll do my best. And I think Letty is here now, maybe, has she made it? So Letty, thank you. And so we can make sure that folks are able to participate. We don't want to leave anyone out and hear from everyone. So Letty, if you are ready, I will turn it over to you.
Good morning. Thanks, Cindy. And thank you, Wilson and Ellen, who helped me. I was having some issues logging on this morning. I'm Letty Zuno, the co-chair of this committee, and I am the executive director of Access to Independence San Diego. Correct me if I'm wrong, but we are on action item number 2. All right, action item number 2 this morning is the review of today's agenda and the approval of the previous meeting minutes. As Cindy said, everyone should have received your the packet that includes the material for today's meeting. So for those of you that have reviewed it, we would entertain a motion to approve the meeting minutes.
So moved.
Thank you, Pam. We have a motion by Pam to approve the minutes from our last meeting. Do we have a second?
Rita Science, second.
Thanks, Rita. Maybe to move this along faster, if there are no no's or discussion, is it safe to say that we are approving the previous minutes from the last meeting unanimously? Say yes.
Yes.
Yes. Thank you. We'll move this action item forward. Thank you, everyone. We'll move on from here to agenda item number 3. Cindy, do you want to lead this one or intro?
So turning it over to, it looks like the CDA, California Department of Aging and Department of Rehabilitation updates, and Sarah and Kim and Denise. So you're sitting next to me, so.
Thank you. So Director Rutledge is here and will start us off.
All right, thank you, Sarah. Good morning, everyone. I'm Kim Rutledge, Director of the California Department of Rehabilitation. And I just want to take a moment this morning to welcome you all today to the ADRC Advisory Committee. I'm excited to be joined here this morning by our partners at the Department of Aging. The work that is done by our shared network of AAAs and independent living centers ensures that our program participants never enter a wrong door. Along with Director DeMorris from Department of Aging, who is unable to be here today, I am committed to this ongoing partnership that is strengthened by this committee's work around our ADRCs. As the director of the department that supports the state's 28 independent living centers, I am happy to share some good news today, and that is that the Independent Living Network has received a $100 million increase in the proposed federal budget. This funding still must be passed by Congress and signed into law, but it is a positive step to see support for the Independent Living Network in this current administration. Also, I just want to take a moment to mention that along with the Department of Aging, DOR is working closely around a lot of issues that have to do with program integrity right now, as there is a lot of attention around that, including looking at the program integrity of our ADRCs and our partner organizations. And with that, I'm now going to turn over to Sarah Steenhausen, Deputy Director of Policy Research and Engagement at the Department of Aging, to provide an overview of the No Wrong Door legislative report that was recently submitted to the Assembly Budget Committee. And you should all have been provided a link to the report.
Great. Well, thank you so much, Director Rutledge. It's great to be here and to see many of you in the room and those on the screen as well. I wanted to say that as Director Rutledge said, you have a link to the report in your materials, and I'm just going to cover it at a high level, and then we have time for any questions you may have. Next slide, please. Sure. Oh, if you could not show the notes. Sorry.
Sorry about that.
No problem. Thank you. Okay, so I wanted to start by kind of stepping back and looking at this issue of how older adults, people with disabilities, and caregivers access information and assistance. This really has been front and center for the Master Plan for Aging. We really see it as one of these 4 critical elements of long-term services and support system change. Really, these 4 elements that I'll walk through at a really high level are all necessary to address, because if you don't address each of them, you're still going to have several problems within the system. So, of course, navigation. This is an issue all of you are here today to focus on as the ADRC Advisory Committee, how people access information to get the services that they need and making it more streamlined and more navigable. But second is, even if you make the system more navigable, we've heard from so many providers and consumers across the state in our work on the home and community-based services gap analysis that we have major access issues, particularly in the rural areas of our state, but also in other across the state, whether it be long waiting lists or lack of availability of programs that people need to meet their needs in the home and the community. So the access issue definitely needs to be addressed. Third is workforce. How can we have the programs and services that people need to age and live with dignity and independence if we don't have the direct care workforce and the rest of the continuum of care of workers that are needed to provide services for this population? And then finally, a big focus on how we finance our long-term services and support system. We all know that for people eligible for Medi-Cal covers, a defined set of long-term services and supports. But for those who are not eligible for Medi-Cal, there's a lot of challenges on how to pay for it. And many people end up having to spend down their resources to become eligible for Medi-Cal. So we're doing a lot of work right now looking at this finance and delivery system, and we're coming out with a very comprehensive report with with a lot of different population research and analytics, as well as policy concepts for consideration moving forward. So again, I just wanted to kind of clarify how navigation is embedded within this broader system change. And I will say that I think that we hear most often about the challenges with navigation. We hear from
Huh?
customers and family members
Yes.
all the time who cannot access what they need in the community. A good example of this is the 2023 statewide consumer assessment survey of older adults, where we had about almost 18,000 respondents across the state. 72% of these respondents in California said that they have problems with knowing what services are available in their local community. So clearly, we have a lot of work to do. And that goes to the next slide. Thanks. So I wanted to, when we think about what a high performing no wrong door system is, we've done a lot of research, and many of you have been part of the different analyses that have been undertaken. But when you think about a true no wrong door system, there's these broader elements of outreach and coordination with a range of key referral services or sources. That means different programs across the network. Person-centered counseling, which of course is one of the core four services you all provide, but then streamline eligibility. How can we make it easier for people to access their eligibility and become eligible for programs and services in a more streamlined fashion? But then ultimately, we need shared governance, administration of the program, and stakeholder engagement to provide ongoing input. And right now, as you all know, there is no state or federal funding to support the establishment of a broader no wrong door system, which would include significant elements of this system, comprehensive website that connects all of our different counties and local resources, protected data exchange, services that behind it that help cover the costs through Medicaid, such as Medicaid administrative claiming, a common intake process, and as I said, streamlined eligibility. So this is really, when we think about a no wrong door system, what we see as the main elements. So in the next slide, I'm going to walk through the three key questions that were elevated in the report to the legislature. So the three key questions are, who is the target population of the no wrong door system? Are we building a centralized one-stop shop or a distributed model? And three, are we driving towards a no wrong door system or a no wrong door approach? So the report details the various options and next steps for implementing a no wrong door system in California, but really focuses on these three key questions. So if you could go into the next slide, I will walk through where the recommendations are in this report. 1, define, 2, enlarge, and 3, streamline. So starting with define. The term no wrong door system is often used, but seldom with the same intent or understanding. I mean, we hear it a lot in our work. There's other programs that seek to have no wrong door systems, but oftentimes they mean different things to different people. So as we refine our framework to support the future system planning and design, we need clarity on first, whether this is a mandated no wrong door system or a voluntary no wrong door approach. So mandates typically come with statutory authority, prescriptive rules for the participating entities across the state, and state investments. Whereas voluntary approaches are often uneven, and you might have a few programs here and there participating, but it's often inequitable with not the same level of outcomes as a high-performing no wrong door true system. The second question is the no wrong door system approach intended to be a centralized point of entry, a one-stop shop, where a wide range of consumers and providers can access all of their information in one place? Or is it intended to have information distributed among multiple reliable community partners and platforms to encourage consumer choice and ease of access? So answering this question would dictate how we staff a system like this, how we develop training requirements, and obviously what resources would be necessary. And then third, who is the No Wrong Door system designed to support? Is it for all ages? We know that the ADRC system serves aging and disability, including developmental disability, but we haven't kind of answered this question broadly for the No Wrong Door system. Is it for all income levels, all areas of the state, all languages? And does this include a broader array of public programs like Medicare, veterans benefits, and Medicaid? The third recommendation of second recommendation of enlarge. The ADRC's 4 core services are important to strengthen and sustain. But while we know that the services provided by ADRCs are critical, ADRCs in and of themselves have not been considered the entirety of a No Wrong Door system. And we also know they're not available right now in every county across the state. So the legislative report recommends that the state expand its thinking to look at all current access points, including and not limited to our 33 area agencies on aging and the 28 independent living centers. So the report suggests that augmenting AAA and ILC structures with enhanced ADRC core functions might be an equitable way and sustainable way to accelerate expansion of ADRC services statewide. So this is more of an incremental change that would maximize the existing AAA and ILC administrative structures, as well as leverage program oversight, which is already provided by CDA and Department of Rehabilitation. And then finally, streamline. I've touched on this, but we know from a lot of our focus groups and survey work and listening session that consumers don't understand the differences between all of these different programs, whether it's AAA, ADRC, independent living centers. So if we're committed to improving navigation, how can we make things easier to understand for the people using the system? Next slide. So I just wanted to point out this visual, we call it our Venn diagram, that illustrates the interrelationship between AAAs, ADRCs, and ILCs. So how might we consider incremental No Wrong Door enhancements to existing statewide entities that would add a real benefit to the entire network? So the report notes that we can make great progress in these efforts by strengthening the current system across all of our AAAs and independent living centers. Next slide, please. So to close, I think it's really important to not forget the strengths of our state. What California has that many other states do not is strong alignment between the aging and disability communities, a shared vision in the master plan for aging, and close collaboration across government, both within Cal HHS departments and with our sibling agencies such as housing and transportation. So given all of this, what do we see as the next steps? Well, unfortunately, we all know that the state is not in a great fiscal situation. We're projected to have a significant budget deficit. May revise is coming out soon. And we also know that there are the looming impacts of the federal HR 1, as well as other federal threats. So even with all of that, we do think there's positioning that we can do now in preparation for better fiscal times. And this is what a lot of the master plan has relied on, doing the advanced planning work. And then when there is a window of opportunity, shoring up the funding to build out that system that had been planned on. So what are some of the near-term steps that could be taken? Well, first we could examine how the programs, the ADRCs, AAAs, ILCs, how we market and brand across the system to make it clear to consumers where to turn for information, assistance, and referrals. We know that in some of our other states, they have a standardized name and logo for easy identification and promotion. Also, how might we build the core ADRC services into all of our AAAs and ILCs using available resources? How can we ensure that there are ways to expand these services again statewide? I think we also need to think about the role that the community health workers can play as system navigators across our AAAs and our independent living centers to help people access the services they need. The reason that we bring up community health workers, we have a couple of pilots underway with some of our AAA and ADRC partners to look at how a sustainable model for a community health worker navigator can be embedded within the current system using available Medicaid resources and supplementing with some of the limited Medicare resources that are available. So we're doing these pilot projects. We're developing a toolkit and a sustainability model to think about what are some ways to expand these navigator services across the system today. We also want to ensure that there's a continuous focus on no wrong door planning and stakeholder engagement, particularly in relation to our Disability and Aging Community Living Advisory Committee that has expressed an interest in this issue. And our Home and Community-Based Services Subcommittee is going to be considering a lot of these questions that were raised in the No Wrong Door report and making recommendations. And of course, any stakeholder entity could also make recommendations about that as well. Finally, one of our near-term steps is to maximize the resources currently available on the CDA website. How can we strengthen the existing California Aging and Information Line and elevate the community resource guide that we have in place in multiple languages? So that's a high-level summary of the report. I'm happy to answer any questions you may have, and Denise is also here as well on the more program-related questions.
So Carol, I see your hand up.
Carol Leash, consumer representing Ventura County. You were talking about marketing and branding, such as logos. Do you have any ideas at this point?
Thank you so much, Carol. No, at this point, it's more of a question that we've elevated of how might it look for if we were to consider that, what are some good ways to approach it? So it's more of a question that we have posed rather than having an answer to that, because we want input from all of you and the stakeholders.
Okay, Joe.
Okay,
and then Carol, I'm sorry, did you have a follow-up?
No, I just said thank you.
It's like Joe.
Yeah, great, thank you. Hey, I appreciate the report. I think there's a lot of good information in this. And I think even Carol's point about the logos, a few things that kind of stood out to me. But, I think this might be an opportunity for this advisory council to look at this report and weigh in. All of us that are currently designated AAAs, the path we came is we had to have our independent logos, right? And so now this report's saying here's some possibilities. And I think that's great, but I think this advisory council really could be a great opportunity to provide input on this, to discuss it, dissect that report a little bit, and come back with recommendations. The only concern I have is sometimes this stuff gets discussed and talked about, and input from either the consumers and or the ADRCs that are currently doing this and this board, this advisory committee. I think it's a really good opportunity for us to come in, and I think it would be appropriate topics for us to be engaged with as we are part of a no wrong door system. So those are my thoughts, and I thank you for listening.
Thanks, Joe. Liz?
I thought we did have a logo. Know that there's a blue and yellow ADRC.
It's at the state level, right? You guys have a logo, but it's not shared across this whole state. That's what
because we were told we needed to use it for all of our ADRCs, and we are. So I didn't realize it wasn't a statewide thing.
Denise, do you have any, or any of you? Wilson, yeah.
Go ahead, Wilson. Yeah.
Wilson with California Department of Aging. So we do ask that our ADRCs use it. However, it's not consistent, as some have modified it, modified the logo into and incorporating into their logo at the local level.
Oh.
And plus, not the entire state, not all counties are involved in ADRC as well.
Yes. Ramon and then Aaron.
I attended a hearing with two subcommittees, one and two,
Yes.
Corey Jackson. And he asked the department about supplemental budget request.
Yes, that's this report.
Okay, good, because I thought, having a chair of a budget committee ask you,
Yeah, no, we're very appreciative of his leadership in this space. Absolutely.
hooray.
Yes, yes. Thank you.
Erin.
Hey, Erin Crutcher, Consumer Advocate, Orange County. Thank you for your presentation, Sarah. It was really insightful. And just with a little bit of background to kind of put some context around the question I'm going to ask. I was, I think, about 30 when I entered No Wrong Door system. And I aged into disability with rare and complex conditions. And just want to state for the record, the No Wrong Door system, that I didn't know what it was called, but how it worked for me was some magic that I really needed at that time in my life as a Californian that was really struggling to figure out a way back into the workforce. So in your report, you had mentioned something about all ages, and my credentials are kind of questioning, is all ages, are we looking at a broad lifespan development from early childhood into older adult area, or are we looking just at adults 18 into end of life? Could you just expand that a little bit?
I love your question, Erin, and I love the personal experience you bring. I'm sure it's really informative to all of this work. But I think it's a question that I have my own ideas, like what I would consider for No Wrong Door. But the question is that there's never been a decision at the state level of how are we defining this No Wrong Door system. There's been different suggestions at different places, but I think that we know that, for example, the Department of Developmental Services is interested in also developing a No Wrong Door system for their consumers. But then what does that mean for the overlap between regional centers and older adults and people with disabilities? So it's those kind of things that we just need to a clear understanding of what the population is that would be targeted by this system. So I think you all can absolutely weigh in on that.
Fantastic. Thank you for explaining. And yeah, we are definitely a great resource to give some insight into what would be the most helpful so that we serve our Californians the way that we've set out to do. Thank you.
Absolutely. Thank you.
Kelly.
Hi, Kelly Takasu. Sarah, so is it up to CDA to decide? Like, who is the deciding factor I know you laid out a lot of options to the legislature. Is it their decision to decide how you're going to move forward, or is it CDA's or?
Yeah, so ultimately, first, there's a couple of different components. Stakeholders need to weigh in, as we've said. These are questions that we're all grappling with. So stakeholders make recommendations, and then the legislature and the administration can both weigh in, right? So on behalf of CDA, any decisions that were made would be, we would have to it would essentially be a governor's proposal because we're part of this administration. If the legislature were to do something, they would also come up with a proposal. It could be done many ways, or the legislature could come up with a proposal and the administration would then have to respond to that proposal. So there's really not one way to go about it. It could be in many different ways. I think the thing to consider is all the questions that were raised about the financing of it and any statutory changes that would be needed to make it build it into the system.
Sarah, as a follow-up to that, do you have, in engaging stakeholders, do you have some sort of timeline or idea of what that starts to look like?
That's a good question. I don't think we really I think whenever, but I think over the next year in particular, we're going to have a new administration and we don't know where that governor is going to be on these issues. So this is a great time to really come up with a common set of recommendations, much like we did when the master plan for aging was getting developed and stakeholders had so much input into it before. And then the state can take those recommendations and consider it. it doesn't mean nothing will happen between then and now, but I think that it wouldn't hurt to have something in a year. I don't know, Denise, any thoughts from you on that?
No, because we are at a cross, the report brings us to these like really large, some of these are very large questions, like how to proceed forward. And, there's questions in there about mandates, requirements, those types of things, which, as Sarah said, really is a weigh-in of the legislature and the administration together to move that forward. And there's always the funding question, and then there's so there's all kinds of pieces to it. So it will not come, it is going to be a process here. Conversations are continuing with the legislature. I do want to point that out as they review the report as well. And so agree with Sarah, like gathering the input, gathering the recommendations to be able to be ready on what pieces can move, where there's support to move when, because CDA alone cannot pull off a no wrong door. A no wrong door, as we is very large across the state, and especially all ages and stages. So.
And building off that, Denise, I do want to note that we did get a grant from the administration for community living to pull together our fellow departments of Department of Rehabilitation, Department of Developmental Services, Department of Healthcare Services, and Department of Aging to really step back and think about what would a no wrong door governance structure look like. But we had great conversations, but again, we kept running into these issues of, well, we don't have a mandate right now. So how might we approach this? And we want to make sure that we're in line with, we take into consideration all these other factors that have been raised. So I think that, any proposal, if the administration or the legislature were to come up with a proposal, it always has to go through input. We can't just make it happen. We would have to, either through legislation or through budget initiatives, it would get opportunity for stakeholder input, but that's not where we are right this moment, so.
Any back of the envelope for some of the ideas of back of the envelope dollars?
That's a good question.
I'm full of them, Sarah.
I know you are. I know you are. And I know that, we did work a lot of, there was the ADRC SWOT analysis that was done in the business plan. That might have had some I don't recall like having any no wrong door specific. I think many people would come up with, it would be a pretty big price tag for the data side and the website, and then ensuring that all the program partners were at the standard they needed to be on to be part of the system. I don't know what that cost.
The one thing we do know is states like New York, who have done a pretty impressive system on this, it was multi-millions and millions of dollars. So we do know it was big to get it done where it was comprehensive and everybody, all portions that would wrap around a person engaged. So we have not sized it here for California, but Sarah's right. There's a technology component alone to this that we know would be pricey as well. But we have to we have to get the directional and the support. And again, this can't be just CDA alone and other departments, because the way our state is set up, we have so many different areas that touch an individual. And so DHC, social services, public health, all of these entities, we have to be swimming the same direction to really make a no wrong door system that accomplishes and mitigates and eliminates closed doors. So.
Yeah, I was trying to do a back of the envelope comparison of us to New York. Thank you, whoever brought that up. Because they have an office for aging, which looked to me like the counterpart to our Department of Aging. And on a per capita basis, for people 65 and older in New York versus California, it appeared to me that their budget was quadruple the budget in California. But that was just a back of the envelope calculation, and maybe it's way more complicated than that. But I thought of that as a point to make to state legislators about what they should be doing for programs for the aging in California. If in fact California is being outspent by New York 4-1 on aging programs, that is like ADRC type programs. I think that's something I would like to show every state legislator. Come on, are we that far behind New York? Maybe I got it wrong.
Well, no, I think you raise an important point. I think I'm assuming what you're talking about is the state's match to the Older Americans Act, so the general fund match. States have, ability to put in more general fund to match the federal Older Americans Act. I'm not totally familiar with how New York does that, but there has been in the past some research that looks at how California versus other states, what share of match they provide versus other states. But then separately, the ADRC and no wrong door question, as Denise said, I remember hearing Denise something upwards of 60 million per year goes into the New York system.
Yes. It was large when we looked into it. It's been a couple of years, but yeah, it's a large amount.
Sarah, did I see your hand?
Yes. This is Sarah Harris, Department of Rehabilitation. Just kind of a thought and more than a question. You talked earlier about, getting maybe possibly California health workers to help navigate Medicare and Medi-Cal. Could it be, maybe advantageous to integrate HICAP into the equation because they already do have that experience and expertise.
Right. No, that's a great point. The community health workers, it's really exciting work, and we can actually probably come back and do a presentation on it. Anna Acton has been leading that work for us, our assistant deputy director. But when we talk about community health workers as navigators, it's really trying to help them develop the expertise so that they can work with the consumer and their families in helping them access all services, including HICAP. If they have questions on Medicare, the community health worker wouldn't necessarily answer all the Medicare questions. They would refer to HICAP. But what I was speaking to when I mentioned Medicare and Medi-Cal was the funding streams, because in California, a Medi-Cal state plan benefit is for community health workers. So we actually have a benefit for community health workers to fund them in the system, but it's not as easy as it sounds. So we're doing a lot of work right now to figure out how our local partners, whether it be AAAs or ILCs, could embed a community health worker in their programs to help with navigation. As a near-term step, it wouldn't hurt. We all know that you all fund people through your programs to do information and assistance and related services. But if additional resources can be brought in through this community health worker benefit, we're trying to see what that might look like. And then we'll be releasing a kind of toolkit on how people can do it. Does that answer your question?
Yes, thank you.
Great.
Hi, Lisa Hayes, CFLC. Have you surveyed the independent living centers to see who has community health workers in their systems currently? Because I know some do.
That's a great question. We did do a community health worker landscape analysis, and I don't recall I can send it forward. I don't know that we included all of the independent living centers, and it was more of a desktop analysis and then interviews with some of our network partners. So it's not necessarily totally comprehensive. So we would always welcome knowing what ILCs do provide in this space. That's always helpful to know.
I know some of them that were doing CalAIM had, it's better to get a community health worker to do that work. And I know where I previously was, we partnered with Loma Linda University to get them trained.
Oh,
to get folks so they're certified community health worker. Well, whatever California.
Right.
Yeah, it's weird here. But they went through the pretty intensive program.
Great.
To do that. So I mean, I would be curious to know how many centers already have that.
Yeah, no, absolutely. It's a good question.
Any other questions? Great discussion.
Okay. Thank you all so much for the work you do and the opportunity to be here.
And
so let's turn it back over to
you. Actually, sorry, Cindy. Sarah was supposed to hand to me. Because I do have two announcements for CDA to round out the Department of Rehabilitation and CDA section. So if that's okay. Okay, thanks, Cindy. So, good morning, everybody. Again, Denise Leiker, California Department of Aging. I have two quick announcements. One, I wanted to acknowledge that the California budget process is underway and moving along. In the governor's January budget, CDA's funding, including ADRC, remained unchanged in the proposal for next year. We do know that the May revise will be releasing soon, and we will see if anything changes. But right now, as of the January budget, everything is intact. And then I wanted to follow up and echo Director Rutledge's comments at the beginning about program integrity and the real intense focus on both federal and state general funds, as well as the making sure that there are assurances in place that no fraud, waste, abuse, redundancy, or duplication of dollars is occurring anywhere. As the director said, it's pretty real, and it's all of us. It's CDA. It's all the departments across California. So what all of us are doing is we are doing a lot more reviewing of our and strengthening of reviewing and strengthening of our operational practices and programs, ensuring that we have full compliance with state and federal requirements. Something that just came up this week, and part of that review is regarding this committee, the ADRC Advisory Committee. Upon extensive review by our legal team, this committee actually falls under the Bagley-Keene Open Meetings Act. And so what that act is it is a law that requires California state bodies, boards, and commissions to hold public meetings with timeliness of posting of all meeting materials, including notices and agendas, and ensuring full public participation and transparency. The good news about this group is we do publicize the meeting. We may not be complying with the timelines, but there's an additional component to it is two-part. One, any subcommittees of the advisory committee or work groups of the advisory committee also fall under Bagley-Keene and must be open meetings. And with that, we need to ensure that all of our operating procedures, our charters, all of the items that run this body align and document Bagley-Keene appropriately. So what does that all mean? Well, this is kind of late breaking news. I don't have details for you now because we just had this conversation earlier this week. But what we are going to do is dive into this more with our legal team in reviewing all of our practices and all of the committee's practices so that we can get everything documented and put together the way it needs to be. What we're going to do while we're doing this review with our legal team is we are going to pause the recruitment of the new members because we'd like to get everything in order. And before we from a time constraint, we'd like to work on this. So at the July meeting, we bring you back for decisions, what needs to be changed, what needs to be strengthened, what we need to do differently. And we can get that all settled before we seat any new members. So we're just going to pause on the recruitment right now while we get our ducks in a row. And so with that, I can take any questions. I don't know that I can answer a lot because, like I said, this came up this week with our legal team. So coming into this meeting, I know what I know today, and I will learn more as we continue to move through this. But if there's any questions, I can take those.
Thanks, Denise. Rita has her hand up.
Hi, Rita.
Yeah, hi, Rita Science. So I'm a little confused by that because it would seem to me that the ADRC committee, given that it does not release funds, would come under the same advisory type of situation that the California Commission on Aging does. And as you know, a couple of years ago, they submitted legislation which got passed, and I think there's an extension out now that allows advisory types of committee not to operate under Bagley-Keene in the same way that grant agencies or commissions do.
So thank you for that, Rita. We had an earlier opinion on that, but recent developments as the opinion has shifted on the ADRC committee related to the statute that authorizes the committee. And so I'm not the lawyer on this, so I can bring back more explanation next time. I am a messenger to let everybody know we're working on this right now.
Yeah.
So I can bring that back in July, that clarity, as well as what we're going to need to adjust to be in compliance. So thank you for that.
Okay. And just for you to know, there's additional legislation pending this year in this
Okay.
area.
Okay, good to know. I will relay that as well. They may already know, but I will relay that as well. Thank you. I
Okay,
appreciate it.
thanks.
Carol.
Hi, consumer from Ventura. Just wanted you to clarify, please. My 2 years on this committee is almost up. Does that mean I need to reapply now or wait till later to reapply?
I'll probably turn this to you, Wilson. Wilson, do you want to answer that for us, please?
Yeah, hi, Wilson with CDA. So Carol, we accept applications pretty much year round. So, you are terming out at the end of June. Feel free to submit your application. It's just that we won't be proceeding with processing any of the applications yet until what Denise had mentioned with just kind of getting our ducks in a row with this new development. But you could so you could submit applications.
Okay, thank you.
Aaron and then Ramon.
Hi, Erin Crutcher. Thank you for the update and the transparency. Super appreciated. You had mentioned subcommittees, and just out of curiosity, could you define that a little bit? I'm curious if that falls under work groups in your mind.
So the opinion, the ADRC advisory, so I'm not the lawyer here, so please bear with me. The ADRC advisory committee does have identified, I'd say work groups or subcommittees, I'm not sure which, that we are calling them. I'll let Wilson correct me on the term, that our legal team has identified that they also too must comply with Bagley-Keene as well.
Okay, I appreciate the clarity, and yeah, that's helpful. Thank you.
No problem. And like I said, this is kind of a work in progress. It came up this week. I wanted to make sure you guys knew we were working on this, and we'll bring back more in July. Not a lot of time between having a conversation with legal this week and this meeting to drill down, but we will bring back more in July.
Okay, Ramon had a question, but he's walking out with Sarah, so I'm not sure what to do with it.
Okay, bye, Ramon.
Short of it is, should folks like us, like Carol, should we show up at the July meeting?
Yes, there will still be a meeting. We are still a functioning group. We need to work out some kinks, if that makes sense.
Part of it, Denise, is those of us who are terming off are still terming off.
Yes, no, it's not changing terms at all, but we want to nail this down before we bring on new members. So it's not changing, it's not interfering with the terms.
Okay. A follow-up to, just because it's going to lend itself to something that we're going to bring up later in this meeting. So of work group subcommittees, as you gain understanding of that, does that mean that the committees can they meet on their own if they meet all the criteria? Or do they have to have a member from CDA at the meetings?
I'll find that part out. I know they have to be publicly posted, and the public has to be welcome to the meeting. That's the piece that they have to, that the work groups would have to comply with is I think it's 10 days minimum notice of the materials and the agenda being posted, and the public has to be able to attend. I don't know about the CDA aspect of that. I'll get some clarity on that.
Thank you.
Does that help?
Sure. No, but we'll figure it out.
It's clear as mud. I know it's clear as mud right now. We're working through it. It's kind of the hot off the press. Wanted to make sure we let you know more to come on this. This group does keep working, but this doesn't interfere with people that are terming off. We're just going to pause on moving forward to processing new applications till we can get all of this sorted.
Okay. So it will just be a much smaller group in July.
Yes, while we move through this process, and then we can go from there.
I feel your pain. Thank you. Any other questions?
Yeah, any other questions for me? And otherwise I can go on mute and you guys can continue.
So the term limits remain.
Okay.
So then we won't be on.
Okay, so Denise, thank you.
Thank you,
Sorry,
everybody.
the agenda.
Thank you, everybody.
Now I will turn it over to Letty for the last item before we take a break.
Thanks, Cindy, and thanks, Denise, for that last update. The next item on our agenda is number 4, committee membership recruitment. You know, Denise talked a little bit about that, but I'm going to hand this over to Wilson for more details on that.
Yes, so yeah, piggyback on what Denise had mentioned, I just want to recognize that we do have 7 members, committee members who are terming out. So I want to make sure that we recognize the 7, including, and we added 8th, Lisa Hayes, who used to be a member, and now she's an ex officio member. So it's like, you know, she's still here. But we want to thank Carol Leash, Cindy Kaufman, Larry Grable, Letty Zuno, Ramon Castelblanc, Sherry Raisler, and William Reed for your service to the ADRC Advisory Committee and recognize.
Yay.
And as Denise mentioned, once we iron out, you know, the Bagley Keene requirements, figure out what we're required to get done, we'll be sure to keep everyone updated back in July when we reconvene.
So I assume you all are going to run the meeting since the 2 co-chairs are terming off.
We do have other AAA and ILP
great.
representatives that we can ask if they wish to be, you know, co-chair.
Okay. Ramon.
So the short of it then is all of the 8 of us, we could show up in July as the members of the public.
Correct. Yeah. These are
And
public.
maybe someday.
Hey, any other questions? Oh, I'm sorry, Letty, that's you.
No, that's okay.
Stepping on toes today.
Yeah, well, if no other questions, we are gearing up for a short 10-minute break. Following our break, we'll head on over to agenda item number 5, ex officio partner updates. Thank you for everyone from the first part of this morning's agenda, and Wilson and the whole team. Thank you for this last bit of acknowledging all of us who are terming out of this wonderful advisory committee. If nothing else, if it's okay with the group, we'll start our 10-minute break and regroup in about 11:15. We'll see you soon.
All right, welcome back, everyone. Cindy, I'll go ahead and turn it back over to you.
Okay, thank you. So up next on the agenda is the officio, partner updates. It's been a long week, folks. And so we're looking at 4 minutes per agency for a report out. And first up is Christina with California Association of Area Agencies on Aging.
Good morning again. And Cindy, you're right. It has absolutely been a long week. It's like the longest year ever. With that said, I'm happy to give you some updates on some of our priorities. I shared at our last meeting that C4A has put forward a budget request to the legislature on increasing the Older Californians Act. Our budget increase was specifically geared towards the 2030 priorities, nutrition, INA, and caregiving support, with a $62.3 million request. We presented at both the Senate and Assembly budget hearings, and we'll see what happens with the May revise. We also moved forward a piece of legislation this year in hopes that we could create some changes that we expect to see. We expect to see impacts of the aging and disability resource connections as a result of the SB 1249 changes that may occur at the local AAA level. What that means is if a AAA is being de-designated, a ADRC could also be de-designated. So we had entered into some language, fix-it language, to ensure a transition period of 1 to 2 years to try to alleviate an ADRC from being de-designated. That bill went through committee a couple weeks ago, had a great hearing. Our author is Laird. He happens to be from the area where there is some de-designation of AAAs occurring. Initially, we thought that Ventura County's AAA was going to de-designate. They have decided to hold back on that and stay in place for at least 1 year. They'll be doing a fiscal analysis to determine how to move forward in Ventura. But next door, their neighboring AAA, which covers Santa Barbara and San Luis Obispo, is going through de-designation. And in the situation of that specific area of the state, both of those 2 AAAs partner with one independent living center that covers all 3 of those counties. So that independent living center is pretty concerned about the impacts of their ADRC. That's 2 different ADRCs. And at this time, our bill to put some fix-it language in place is going to appropriations next. But we did hear yesterday that it's unfortunate, but it's on suspense instead of consent. So we're looking to see what happened, and hopefully we'll be able to change that before the hearing. In addition, C4A is going to be having a strategic planning session in Sacramento, May 5th and 6th. And we will be doing our advocacy day the following on May 7th. We know that that's also the same day as the California Collaborative Advocacy Day. We'll be doing visits in person, not virtually. And then next week, C4A is a founding member of the Aging and Disability Coalition, and we are very excited to be hosting a reverse gubernatorial town hall next Friday at 10 a.m. If you'd like information on that, you're welcome to attend. It's on our social media sites, but the purpose and intent of the reverse town hall is to really give the candidates an opportunity to learn about people with lived experience, both older adults and people with disabilities, in hopes that they will prioritize some of our issues if they become elected. And I'll stop there. I think I hit my 4 minutes.
Christina, thank you so much. Next up is California Department of Veterans Affairs. I'm not sure if anyone joined.
I will be presenting on behalf of David Lawrence, who is unable to join today. I'm going to abbreviate his update just a bit in lieu of time, but happy to send out what he's provided following the meeting. From David, the Veterans Support to Self-Reliance VSSR pilot program provides enhanced on-site services to high acuity veterans age 55 plus living in permanent supportive housing across California. Services include skilled nursing, medication management, peer support, and geriatric social work. The program demonstrates that through a housing-first approach and evidence-based care, aging veterans experiencing chronic homelessness can successfully age in place while achieving stability and improved quality of life. A quick program update. The 3-year observation period for the VSSR pilot program concludes on June 30th, 2026 of this year. CalVet hosted a final program convening on April 15th, where operators and participants shared the following key insights. Some of the key accomplishments included increased stability and engagement among veterans, resulting in fewer crises and more routine care, a stronger trust with veterans actively seeking and participating in services, improved quality of life through better access to healthcare, transportation, and social connection, a greater sense of community and belonging. There's additional information about this program that, again, I will send out following our meeting.
What does it stand for?
Sorry.
What does it stand for?
It stands for Veteran Support to Self-Reliance.
Okay, thank you.
And I'll go ahead and include a link to the program as well.
Thank you. Next is California Commission on Aging. Dr. Haregi, did I get close?
Close. Howdy. Howdy.
Okay,
Thank you. Good afternoon, everyone, or good morning, everyone. CCOA, the Commission on Aging, is planning an informational hearing on June 11th in Sacramento, and the topic will be supportive housing and assisted living. Also, we have just recently posted a batch of bills and budget ask on our website at CCOA. You can find it under our advocacy tab. And last, CCOA has organized a cohort of state agencies to embark on a 6-month course of age-inclusive management. So we're excited to see where that leads us and how we can all continue to work together across the state. And that is it.
Thank you. Next, California Foundation for Independent Living. Lisa?
Yeah, Lisa Hayes, CFILC. We've been extremely busy with in our public policy area. A lot of the legislation that Christina mentioned, we are also supporting, including what we're calling the ADRC Fix It bill. I encourage you, if you're interested in these large slate of policy issues that we're looking at and supporting, to look at our website at www.cfilc.org. We have a priority legislation tab, which you can see a number of different pieces that we're looking at. A couple of other things that we're doing, we had to revise how we were approaching disability disaster access and resources, doing some funding changes. Our focus this year is on education and outreach. We're working with PG&E to really do a lot of that work. We will still be supporting the events when power is shut off, the public safety power shutoffs. But our entire DDR team is kind of getting up to speed on, really just taking a look at more education, outreach, and data gathering so that we can, increase the work that we're doing in DDR. We're also we're going to, CFILC was awarded the AT grant. We're very, very close to issuing an RFI for the device lending library and the reuse program. So we'll be sending that information out very shortly to all of our partners so that you can get that information out. We're also partnering with Disability Rights California to participate on May 26th in the CDLA event. That's the California Disability Leadership Alliance. So we'll have more information. That's going to be happening on the West Steps in the Capitol. That's all I have for right now. I hope. Go on.
Thank you, Lisa.
Thank you.
Next, California Department of Developmental Services. I think Allison is on.
Yeah, thank you, Cindy. Allison Giannini, Department of Developmental Services. I don't have any updates since our last meeting, but look forward to July because some of those projects we are looking to be completed by that time, and so look forward to sharing that out in July. Nice to see everyone.
Great, thank you. California Department of Healthcare Services, Tom.
Hi, can you hear me? Okay, I just want to make sure my microphone's working still. Yeah, no, I currently don't have any updates to share this month. But yeah, thank you for having me a part of this meeting group. Appreciate it.
Thank you. California Department of Rehabilitation, Sarah.
Oh, hello, everybody. I'm going to keep this short and sweet. I don't have any updates to share.
It is very short. And then, where am I on my list? California State Independent Living Council. Carrie?
Hi, everyone. This is Allison. I'm actually going to be doing our updates. So I'll keep our updates pretty short. We just wanted to share that everyone is welcome to attend our spill committee meetings as we begin developing the next 3-year state plan for independent living. The spill establishes the statewide vision, goals, and strategies for how independent living services are delivered, coordinated, and strengthened so people with disabilities can live independently in their communities. We meet on the third Monday of the month from 12 to 1:30 p.m. virtually via Zoom. Our next meeting is scheduled for this Monday, actually, April 20th. For more information about the spill committee meetings or any of our SILC meetings, you can go to our website, which is calsilk.ca.gov. And then we have a meetings and notice tab on the website. Our meetings are all open to the public. And I'll also try to put the link down in the chat as well. But that's all I have for you guys today.
Great, thank you, Allison. And Letty, I'll turn it back over to you.
Thanks, Cindy. We're going to move on to agenda item number 6, the committee work group discussion. And I believe leading this discussion are Cindy and Erin Crutcher.
And I'm going to let Erin take it away.
Great, thank you. So today we're going to be reviewing the final memo that we'll be submitting from our work group on behalf of the advisory committee for the updates to the mission, the vision, and the values. And for starters, I just want to acknowledge thank you to Ellen and Wilson for the extra time you've spent with me and Cindy for helping us getting the polling going. It was a really critical part of this group because I wanted to ensure that we involved as many stakeholders as possible in the outcome that we're going to be discussing today. And also thank you to the entire advisory committee and those who participated in our surveys. It was really useful information. Everybody's insights really helped us make decisions to get to this final outcome. And I also want to thank Lisa, while you were still in our work group, it was great to have you. And Carl, Joe, and Kelly, thank you so much. And of course, my co-lead, Cindy. And I want to give the floor to my work group if they'd like to share any of their insights and thoughts about our final outcome and just the incredible work we accomplished in the last year.
I see Kelly's hand and then Joe's hand.
Hi, Kelly Takasu. First, I just want to say kudos, major kudos to Erin and Lisa for leading this group. Honestly, we wouldn't have been able to do anything without Erin's commitment and a massive amount of work that she did on the back end. So I just want to say a big thank you to both of you. I think what you see in the draft that was distributed is what Erin was explaining is that, a combination of all the work that we've done together. And so thank you to this larger group for your support. I think that what we produced will definitely help more people connect to us. I know in my world, in the Alzheimer's world, going to the ADRC is not the first thought about where you're going to go. And so I think the way that we've phrased it will help people connect better with the services that we provide and help them get connected and bring them into the system so that we can support them on their journey as they age in place or live with Alzheimer's disease or support or care for somebody living with a long-term disease like Alzheimer's. Thank you.
Joe.
Yeah, great. Thank you. I just want to say the work group was very deliberative. Erin, I think had a great influence on this, and I think just want to emphasize that You know, I've been on a lot of different committees over my career, oftentimes vision and coming up with these things, you know, becomes performative. We get them done quickly, but we really took a lot of information in. We had long discussions on it. We wordsmith these, and I think even closing out with the memo as presented, a lot of thought was put into it. So I just want to emphasize that to the rest of the advisory committee, that there was just a great amount of thought, input, and focus to really make this a meaningful values and mission statement. So thank you to the committee and appreciate everyone that provided input.
Thank you both for your shares. And just in lieu of what was shared today by CDA, as far as the review that's going on legally, we did our best without knowing that we needed to open this to public comment. We had a consumer advocate, myself, we had AAA represented, we had ILCs represented, and also the Alzheimer's group from Kelly. So again, if a program review or anything is needed, I've tracked everything like the data nerd that I am. And I also just want to, you know, before I hand this back over to Cindy, it has been an absolute joy to lead this work group, because I do firmly believe that the ADRCs, if they didn't exist, I wouldn't be here representing consumers today. So thank you for that. And Cindy, I will hand it back to you to go over the draft. Thank you.
Sure. Thank you, Erin. And again, a huge thank you to you and your leadership in this. It was very much appreciated. So part of the documents that came with the agenda was a memo and Erin, I love it when people just ask an ordinary question. It's like, so do we send a memo? It's like, I don't know. So we discussed it and decided that it would be a nice way to formalize it somewhat, of saying, these are our recommendations, and put it within a memo. So I'm assuming folks had a chance to read it. I'm not going to read the entire memo. I thought what I would do is just, Erin and I talked about it and just highlight and what what the work group's thinking was on it. So this is coming from the advisory committee to CDA, and it is a recommendation to adopt the statewide vision, mission, and values. We begin it with a purpose of ADRCs to set the stage, and then the actual recommendation that includes the vision statement, the mission statement, the values statement, the values that were identified. And okay, now, was the last meeting our last vote on the values, or did we vote before? I think it was the vote. So the values that came out of the vote, just in case, so everybody knows, were access, choice, independence, and dignity. So we've got the vision, mission, and values. And then we had conversations around, how do we start to tie this in to bigger pictures? And I was struck with something that Sarah said earlier in her presentation, in that people are unaware of services. People are unaware of ADRCs. So how do we start to implement those things? So one of the things that within the memo, we wanted to show the alignment with CDA initiatives. And this included the master plan for aging, the goals. And so there are specific areas under goal number 1, 2, 3, 4, and 5, and and all of these things, we were trying to draw a through line of, this is what the ADRCs do. This is how it aligns with the various goals. So that one, and then we also included improving service coordination and access, enhancing equity and cultural competence, and then building public trust and accountability. So these were areas that we wanted to highlight that were part of embedded in the mission, vision, and values. And then we took it one step further, which is really what made me think about it when Sarah was talking, of how can we integrate this in, what are the suggestions? This is not an exhaustive list by any stretch, but these are some of the ways of suggestions of integrating it into strategic planning. And part of what we looked at was this can be a statewide level, this can be a local level. And this is, I think the timing was good. It's around branding, right? How do we start to think of these things? Using it as part of staff training and orientation. It is not only at a local level, but also as a state level. Is this something that gets brought up in an orientation with CDA, with others? So these are some of the ideas. Then public communication and branding. So I don't know where I heard this. I probably made it up because I have a tendency to do that and then fully believe in it wholeheartedly. But I've always heard that for marketing and outreach, you have to, connect with someone at least 7 times. It's either 7 or 10. And before they start to hear it again. So it is one of those things of putting it through all of these things. Then suddenly maybe someone next to you, when a friend is talking, will say, oh, I heard about this ADRC. Is there one in your area? And then looking at it through the lens of quality assurance and evaluation, and taking a look at how do we measure how we uphold these values in service delivery. So there's a lot here, and some of it is it is suggestions and ideas. And so then happy to answer, along with the committee, answer any questions about this, about the memo, about any of this. And the next step is to send it on.
I appreciate the memo format and how you guys organized it. Feels clear, and formal, a little more formal than just telling you,
Thanks, Melissa. Rita.
Did we get a copy of this memo?
Yeah, it came out in the agenda and all the documents.
Because I don't see it in mine. Could someone send it to me, please?
I'll be happy to send it to you, Rita, and we'll also include it again in our post-meeting attachments.
Thank you.
Carol.
Of the 5 goals, which one or even 2 do you think are the most important to focus on?
Ooh. I wouldn't personally, and I'll let other committee members join, I wouldn't focus on one over another just because it's all part of the master plan. And I think it depends also sometimes on a community and what the needs and the abilities are in various communities. But that's a great question. I also think maybe sometimes it's how we are presenting this and tying it in. It's just a suggestion, CDA, but that's a great question. I don't know if any of the other committee members have any other thoughts.
I'd like to weigh in. This is Erin Crutcher. The way that I look at it is if we go back to policy and we think about the no wrong door policy, really my experience and also what I know the law states, it's about meeting people where they are. And so with the Master Plan on Aging, because I was fortunate to have an internship at the SCAN Foundation when that got signed into law, and truly the Master Plan on Aging and all the committee members that helped design that Sarah had elevated earlier today, it was about everybody finding a place no matter where they are in their journey around aging. And so when I think about the no wrong door policy and how we work together as a work group to put together the tie-ins to the ADRC and the Master Plan on Aging, it was with the idea that we could reach as many people indirectly through those statements, because the need is great, as we know. So yeah, thank you.
Yeah, and I would comment, I think the Master Plan on Aging and their 5 goals, that's something that CDA and the state's working on. I think this really just exemplifies how the ADRCs fit into all 5 goals of the Master Plan on Aging. And kind of like Sarah said earlier, as funding and things become available, they can advance various parts of it. So I really just think it's shining a spotlight on the ADRCs and how in line the ADRCs are with the Master Plan on Aging.
Any other questions? The none? Oh, Pam, sorry.
That's okay. I didn't get my hand up very quickly. I was just going to mention that, at least in our area, the most important thing with the Master Plan on Aging has not been so much prioritizing or adherence, particularly to those 5 goals. It's been the local implementation of our local playbook, which we have done very closely working with our ADRC, especially in San Benito County and with the AAA. And I would just encourage folks to get if you are representing an ADRC, to get in on your own local playbook and work with the folks on that to make sure that ADRC gets included in your local, as you implement your local plan.
Thanks, Pam. Okay. Feels like we're wrapping up the vision, mission, values. So I am going to launch, and Letty, you were part of the conversation we had with CDA staff too, in the next part of this agenda. And so this, we've got looking at committee priorities and established work group engagement. So this, Letty and I, and we have had lots of conversation. Well, we've had several conversations with both current members as well as previous members, and in trying to help people feel engaged in the committee itself. I think it's pretty easy for the AAAs and the ILC portion of the ADRCs to have lots of opinions around it, but also wanting to hear from the other stakeholder groups a lot. And so we've heard a variety of ideas of what we could do. There was something that came up recently and somebody said, this was great. I felt really engaged with it. And so part of what we were looking at, this committee group came together, and as in the work plan, as we were identifying it, I can remember, I think Wilson, you said that's going to have to be committee led because we don't have bandwidth. And Erin, God love her, said, okay. And so we had some level of expertise, and it got us to thinking a little bit around the work groups themselves. And CDA has been in with the my memory serves me, has been involved in all of them except this one. And this one, we were able to do something and put it forward. And so part of it is, I think in big groups like this, we will have discussions and there will be input, and it's great, get great feedback. But work groups are that, right? They're work groups. They are the ones who start to bring products forward, and so that people can respond to it, as opposed to, having a group this large start to create things. And so part of it was looking through the current work plan. This was before Denise's announcement, so it may alter somewhat, but taking a look through the current work plan and seeing where committee members could truly participate and lead in those efforts. And so I went through and took a look at all the various objectives. And there are a total of 8 objectives in our work plan, although I will say objective 2.1 has a second part, which I think could be pulled out and called objective 2.2. I'm just throwing it out there because, I'm leaving, so I can throw things out there. And so then of those 8 objectives, there are at least 3 that I think, and I am open to disagreement on this, at least 3 that really have to be CDA led, just by their very, so one of them is enhance and implement ADRC designation criteria and process. That is a CDA item. We respond to it, we give input on it, but I think that one is one that they are truly the leader. Another one is 4.1, which is update and enhance monitoring policies, procedures, and tools. Again, that is in their basket. That's something that we respond to. And then the last one is 5.1, which is develop and implement Medicaid administrative claiming process for supporting ADRC and no wrong door system functions. Again, those are the three that are truly in CDA's wheelhouse. But some of the other ones, I think, are ones that can be committee led. So we have, let's see, there are current committees right now, which are 1.2, which is the educate outreach to non-ADRC affiliated AAAs and ILCs in efforts to expand the ADRC network. That one is a joint committee that is CDA led. It is one that's currently happening. Whether or not it has to be CDA led, I think that's up for a conversation. The other one is 5.2, which is explore Medicare reimbursements for funding local ADRC partnerships. That one is committee led. So I think these are two that are happening right now. The other ones are the ones that are potentially committee led include what I am designating 2.2, and that is, so we did the vision, mission, values. And so the second part of that is explore if the current ADRC brand is resonating with stakeholders, consumers, and how we can increase engagement statewide. I think pulling together a plan for that is something that can be committee led. And I am so depressed that Ramon is not in this room because I was gonna call him out. So I will have to remember that when we come back. The next one is 3.2, which is reactivate promising practices program for peer-to-peer sharing of experiences and effective practices used to develop and advance the ADRC model. I love the promising practices piece. And that one is something that totally could be committee led and brought together. And then the last one is one that is already, that one is the one that is already committee led and is active. So these are ones I'm planting seeds more than anything of just getting people thinking about these work plans. This committee, the original thought was, let's get volunteers now. And certainly people can volunteer now, I think. But given what Denise said, that things may change slightly, I think we just have to follow the rules probably in order to move forward with this. And so we will get new members eventually. Some members will come off. And so it's hard to start to create committees just on the fly. But I did want to plant the seed. I think the other thing we can think about in this is it doesn't only have to be a committee, right? It doesn't have to be, it doesn't have to be this particular membership. It can be people we know that are excellent at this type of thing. They can come in for the work group, the subcommittee work, and then that is their contribution. It also introduces them to the broader committee so that we've got potentially a kind of a pathway in of people who are interested that may not know about it. So these are, I will stop talking and listen for questions. If people are interested, I think we can take down names. We won't do anything immediately until we get some guidance. But just thought I would throw it out there. And really, this came out of these two pieces, both the work this committee just did, and it was fun. And Joe is right, man, we had some great conversations and dove down into some of this. And it was, Aaron had an interest and had a passion in it. So I was scared to death of it. And I just so appreciate the experience. So I just think it's great opportunity for getting people engaged, as well as just kind of moving the work plan forward in a very proactive way. And I know I said I would stop talking, now I'm gonna stop talking, and yeah, Melissa.
So other than the vision, mission, and values committee, have any of these other work groups started? No, thank you. Cause I'm like, I see my name and I'm like, I don't remember being invited to this, but maybe I missed it. Okay, thank you.
So I think this is also opportunity to take a look at some of these where I don't know that they have to be CDA. I think CDA is always invited. But it is one of those things when you have when CDA is in the room, the conversation changes. And so I think there's value in that, but I think there's also, and it's not like this is a shy group. It's not like any of us step back and say, we relinquish this to you, but it just, I think it's different opportunities. Oh, Kelly.
Hi, this is Kelly Takasu. If it's a question for Denise, I don't see her online anymore, but when she talks to the lawyers, I just know in our work group, we were so agile because we could say we're gonna meet in like 5 days. Let's just jump on a Zoom call. Let's just get this done really, move quickly, have a deep conversation, and then, you know, if we have to follow the Bagley King rules and if it has to be 10 days in advance, it just creates more restrictions on how we meet. So it would be helpful from the lawyers to know what exactly are the requirements going forward. I just think that would change. Having been on this committee for a couple of years now, our subcommittees have been kind of informal. So if it's a more formal setting and it has to be recorded and accessible to everybody, I just think it might change how open we are when we talk and the ideas that kind of flow and come. I'm all for, making it accessible and making it open to the public, but I just want to think about like how that's going to impact, I guess, the agility of these work groups in order to keep with our timeline.
Great. No more emails either. Yeah, Melissa.
I think I would ask the attorneys or whoever's consulting to differentiate between standing work groups and committees or subcommittees and ad hoc committees. My understanding is that there is a difference in terms of how they are treated, at least like for local folks and Brown Act stuff, but I don't know how that works with the Bagley Keene and the state level. So that would be a question I would have, because yes, if all of the work groups require Bagley Keene requirements, that does limit the agility for sure.
Yeah, Lisa with CFILC. I'm just curious though, because maybe we didn't do Bagley Keene with this group, we're not at risk of like having to do this work all over again, right? I mean, the work is still valid, done. I mean.
No, this is Susan Rodriguez. I would hope not. And that's something that we can take back to.
That would just bite.
It would, but I'm also gonna speak out of turn a little bit, just in that, to me, it should be a hand slap, because otherwise they're gonna have to go back for years and years and years, right? And that makes no sense. And to have a hand slap going and saying, well, it's a corrective action plan is how I look at it, right?
Going forward, we won't do it again.
Yeah.
But the work that this group did was obviously incredible, I think, and would very much be unfortunate if it had to start all over.
Erin and then Liz.
Hi, Erin Crutcher. Just want to echo everybody's sentiments. That was the first thing that went through my mind, Lisa, when Denise gave a report. I was like, oh, darn, because, I truly would have ensured that we had public comment throughout the process if I knew that that was something that needed to be. And then I also think if I can just step into like a compassionate and empathetic space for other consumers, some of the things that we discussed, right? Like I have a background in marketing and brand management, and I'm a gerontologist, and I'm a patient advocacy lead inside of biotech development. So a lot of the terms that I know I used and that we discussed, I think would have been really hard for public to follow, perhaps. And when we think about access, something, it's like if there could be a harmonization of, the lawyers really understanding the policy. I would have loved to, before we brought, the final draft to the committee first, to send to CDA, to have like an actual public comment part of the entire process once we had gotten it to a point where really we needed them to weigh in. Like, is this resonating? Because then we would have tackled that other part of the work plan that Cindy just elevated needed to still be done, and moved to 2.2. I think I would love to see a way to integrate and ensure we're complying with the law, but also not overdoing it for people that don't need to be in the back ends of all of these high level conversations.
Liz. So I have worked a lot with Bagley Key, of course, my career, and there are some workarounds. Like if you have a small group, like 2 or 3 people, usually you're not covered by Bagley Key. Also, having a standing meeting for work groups or committees helps just make it easier for staff to put out the notification. When I explored what were the consequences of not following Bagley Key, it's really about if somebody files a protest or complaint, right? And so again, being engaged with your public, hearing people out, giving them an opportunity to speak their mind reduces the chances that they're going to file a complaint. When I researched the history, the complaints that have been filed have been primarily against coastal access commissions, that are deciding what happens with beaches and public land along the coast. That's where the most Bagley Keen protests or claims have been filed. Interesting. Money. Yeah.
This is Susan Rodriguez. Thank you all for that input. That's helpful for us to take back to the attorneys as well.
Great. I was wondering where this was going to go after Denise. So this was great. It was a great conversation.
Lisa Hayes. Can it be recommended to the attorneys or ask, I don't know if, could next steps be to put this out for public comment? And to cover that, or allow people to provide input in it at that point. Would that cover us, I guess, to instead of, voiding the work that was done?
I'll add that to the list.
So go ahead.
I do want to highlight too, I'm sure we all listened to Sarah's conversation or presentation and had a lot of points about this very topic. And so this is a very timely resource, regardless of kind of how we move forward. Anyways, I think that drawing the 2 parallels to those is important. So the work is valuable in what you did.
Sarah.
I just want to, I guess, bring up a suggestion. So before I worked for DOR, I was the Blind Advisory Committee Chair. And what we would do is quite regularly, we would have legal come and present on Bagley Keen, especially since the last few years, things, change and go up and down and around. And that's helpful because then everybody gets the same information. So just wanted to throw that out there.
Yes. Thank you.
So given that suggestion, I think we will still send the memo and then you all can decide whether you want to open it up to public comment. Does that feel right-ish?
As the recommendation from CDA, yeah. That'd be good.
Great. Okay. Thank you. Ready.
Thank you, Cindy, and everyone for all of this conversation. Initially, and especially around the committee and the importance of the committees. And we did talk about holding off on creating additional work groups until the beginning of the next fiscal year. And then again, in line with what was shared earlier about having legal take a look at how we're hosting and facilitating these meetings. At this point, we are at agenda item number 7, the summary and action items of today's meeting. Wilson, I know you normally give us a better worded summary of today's action items. Otherwise, I could go through my notes.
Yeah, this is Wilson. I have one item is providing an update on the committee changes, and we'll plan to do so at the July meeting.
Okay, thank you for that. And I'll hand this back over to Cindy.
So agenda item number 8, future meeting dates and agenda items. So as I mentioned at the beginning, this is the last meeting of this fiscal year. So the meetings for next year for now are to follow the same cadence, which is the 3rd Friday of the first month of the quarter. Oh, good. Thank you so much. Which makes it July 17th, October 16th, January 15th, and April 16th. And truly encourage everyone to provide input for agenda items. I think some of the best conversations have come from just somebody was thinking or somebody heard something in their community. So, and then also we share the SurveyMonkey web link to solicit committee members' feedback on how we can improve the committee and the meetings. That's partially how this idea of having it be committee-led came from, is the feedback from folks. So, and then if Ellen, somebody can post the SurveyMonkey.
Yes, I'm pulling it up right now.
Thank you. And any questions from anyone? Okay, Letty, back to you.
Thank you. We are at the public comments portion of today's meeting. About 5 minutes or so of time left. If there are any comments from the public, this is an opportunity to enter those into the record.
Members of the public, if you would like to make a public comment, please push the raise hand icon on your Zoom screen. I will see that and I'll announce your name and unmute you and allow you to talk.
Thank you. I'm not seeing anything on my end. Just want to make sure we don't skip over anymore.
Any hands at the moment?
Seeing none, I'll hand this back over to Cindy to close us off.
Okay, so we are ending a little bit early, which, you know, I always like to put time back in people's accounts. So can I have a motion? Oh, before the motion, I just want to thank you all. This is my last meeting. I just want to thank you all. This has been a great group to work with. I've learned tons and had just a great time. So keep up the good work.
Thank you.
Yeah, thank you, Cindy. It's been a pleasure. Congratulations on your retirement and your next chapter.
Thank you, Cindy.
So Kelly.
Can I make a suggestion for future meetings after we figure out how we're gonna bring on new staff or new members of our committee? If we could maybe pick a date and try to attend in person. I know there's a lot of value in being in person in Sacramento, and I wish I was there with you in the room. It looks super full, and I love that everyone is there, and I'm assuming you guys are gonna go out for lunch afterwards. And so, as the membership flips over, and thank you to everybody who has served and is rolling off, that maybe when the next group comes on board, that maybe we try to make an effort to just meet the new group in person.
think that's a great idea. We do that at work. We've got a large, and we've got in the habit of Zoom, and then we dedicated one meeting a year, and everybody in. Everybody loves it. So I think that's a great suggestion. Okay, with that, can I have a motion to adjourn?
I so move.
I've got a first and a second.
Rita signs, I so move.
Okay. And you're seconding, so all in favor?
Aye.
Aye.
Motion carries. Thank you all.
Thank you.
Yeah.
Thank you.
Have a great weekend.
Thank
Oh, can I
you.
have the July in Sacramento?